continues to take a toll on global health. Scientists are increasingly recognizing COVID-19 as a multi-system condition that can cause disease throughout the body, likely by triggering pathways that cause inflammation. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about COVID-19 and its adverse effects on diabetic people. Patients who contract COVID-19 face a higher risk of developing cardiovascular diseases and diabetes, particularly in the 3 months following infection, according to a new study published July 19th in the open access journal PLOS Medicine. In the new study, researchers investigated whether a sample of COVID-19 patients developed new cases of diabetes and cardiovascular diseases at higher rates than a sample of people who have never had the disease in the year following infection. They analyzed anonymized medical records for more than 428,000 COVID-19 patients and the same number of control individuals matched by age, sex, and family practice. The analysis showed that COVID-19 patients had 81% more diagnosis of diabetes in the first 4 weeks after contracting the virus, and that their risk remained elevated by 27% for up to 12 weeks after infection. COVID-19 was also associated with a 6-fold increase in cardiovascular diagnosis overall, mainly due to the development of pulmonary embolism or blood clots in the lungs and irregular heartbeat. The risk of a new heart disease diagnosis began to decline 5 weeks after infection and returned to baseline levels or lower within 12 weeks to 1 year. The researchers concluded that COVID-19 infection is associated with an increased risk of cardiovascular disorders and diabetes, but fortunately there does not appear to be a long-term increase in the incidence of these conditions for patients who have contracted the virus. Based on these findings, they recommend that doctors advise their patients who are recovering from COVID-19 to reduce their risk of diabetes through a healthy diet and exercise. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.